Hi everyone. Today we are going to discuss about the routes of drug administration in general pharmacology and myself Dr.Preksha. So most of the drugs can be given by different routes and routes of drug administration is very important yet basic topic for all the MBBS students and NEET PG students. So first we begin with the classification of the routes. So drugs can be given for the local action and systemic action. So for local action, for example, topical route that is by the skin and mucosa. Then intra-articular that is into the joints. Then intrathecal that is into the spine and systemic route that is enteral via intestine that includes oral and rectal route, then sublingual and transdermal route, parenteral that is by intravenous, intramuscular, subcutaneous and intradermal routes. So first we will begin with the topical route. So lotion, ointment, cream, powder. These you can apply locally over the skin to exert its local effect. Then lozenges that is given for the oropharyngeal action, for example in pharyngitis. Then drops and spray that you can give with the help of nasal mucosa. Then drops you can also give by eye or ear canal route and suppositories that you can give by anal canal or pessaries that is given by vaginal route. Now coming to the deeper tissues, for example, hydrocortisone which is injected into the knee joint that is intra-articular injection and that exerts its local effect. Then lignocaine that is given by intrathecal injection. Now oral route. So this route is very commonly used and advantage of this route is it is very convenient for the patient, safe for the patient, economical also and self-medication is possible. Disadvantage of this route is slower onset of action. Once the patient takes the drug orally, then it will take minimum of 40 to 60 minutes to exert its effect. Then these drugs can be destroyed by digestive juices, for example penicillin G and insulin. And apart from that, it is also destroyed in the liver that it exerts its first pass metabolism. Now this route cannot be used for the uncooperative or unconscious or vomiting patient. So in this case you have to use intravenous route that will be safest to use. Now the biggest disadvantage of this oral route is first pass metabolism. So what is first pass metabolism? That we will understand by this figure. All the drug that you give by oral route that will enter through the esophagus to the stomach. From the stomach it will go to the intestine. Now from intestine it will reach to the liver with the help of portal vein. Now some of the drug will be metabolized in the liver and the rest of the drug will enter into the systemic circulation. So this process is known as first pass metabolism. So what is first pass metabolism? Drug which is destroyed by the liver before reaching into the blood or systemic circulation. So this is very important concept for the MBBS students. So next is sublingual route. So here the drug is kept below the tongue and lingual are the vein. Lingual vein will absorb this drug and the drug will reach directly into the systemic circulation. So advantage of this route is it will have a quick onset. For example, glyceryl trinitrate when you give by sublingually it will dissolve locally and it will exert its effect within 1 minute for the angina pectoris, and it will also bypass the first pass metabolism. And suppose the patient has taken 5 mg of glyceryl trinitrate, 3 mg of the drug is absorbed and 2 mg of the drug is left still here. Now, if the patient has relieved from the pain, then the patient can spit it off to terminate the action of the drug. So that is its biggest advantages. So disadvantage of this route is only lipid soluble and non-irritant drug you can give by this route. So this was about the sublingual route. Now coming to the rectal route. So advantage of this route is irritant and unpleasant drug you can give by this route. In those patients who are having a recurrent vomiting and who are unconscious, in those cases you can use this route. For example, diazepam, which is used in a children for febrile convulsion. Disadvantage of this route is it is inconvenient and absorption is often slow and unpredictable. Now coming to the transdermal route. So here the transdermal patch are applied over the skin. For example, over the chest, abdomen, upper arm, and it will exert its action by releasing through the membrane. So it will directly provide controlled release of the drug, and it will provide continuous smooth plasma concentration of the drug in the blood. It also bypasses the first pass metabolism. For example, glyceryl trinitrate and nicotine patch that you can give by transdermal route. Disadvantage of this route is it is expensive and it can cause local irritation and dermatitis. So when you give the drug by transdermal route, it will have a 1 to 3 days of action and provides smooth release of the drug. Now coming to the parenteral route of drug administration. So parenteral means the drug is given with the help of injection directly into the systemic circulation. So par is beyond, enteral means intestine. So you are bypassing the first pass metabolism here. So first, that is intravenous route. So here you can see in the figure that the drug is given by intravenous route and the angle of this is 25°. So that is the technique to administer the intravenous route of administration, and advantage of this route is 100% bioavailability because the drug is bypassing the first pass metabolism. It is based for the emergency. Whenever there is an emergency situation and if you want immediate onset of action, then you can use this route. Highly irritant drug that you can give by intravenous route. And disadvantages of this route is locally thrombophlebitis of the injected vein and necrosis can occur if the drug extravasates. Another is air embolism that can also happen if you give the drug by intravenous route. So intravenous route, the biggest advantage is 100% bioavailability and that is commonly asked in the exam. So this is very important for you. Now coming to the intramuscular action of the drug. So here you can see in the image that the drug is given at a 90° of angle directly into the muscle, and this can be given for oily or depot drug preparations. Now disadvantage of this route is local hematoma, especially in anticoagulant treated patients. And another disadvantage is chances of nerve injury. So these two are the disadvantages of intramuscular route of administration. Now another is subcutaneous route. So here in the image you can see that this drug is given at an angle of 45 degree, and beneath the skin there is a subcutaneous tissue that you have to give the drug. Advantage of this drug is self-administration is possible. For example, insulin in diabetes, in those patients you can train them to take the drug by self-administration. And another is heparin. Disadvantage of this route is irritant drugs that you cannot give, and in this route if the patient is in shock, then the patient is already in a vasoconstricted phase. So in that case, you should not use this route because there is a powerful vasoconstriction in this shock patient. So the drug will not be absorbed. Now another route is intradermal route. So here you can see in the image that the drug is given at a 15 degree of angle by raising the blab of the skin, and BCG vaccine and sensitivity testing that can be done by intradermal route. Now this is the summary of parenteral route. We have seen intramuscular, that is given at 90 degree of angle into the muscle. Subcutaneous, that is given directly into the subcutaneous tissues at an angle of 45 degree. Intravenous, that is given directly into the vein, and intradermal, that is given by raising the skin blab at a 15 degree of angle. So this was the summary of parenteral route. Now this is the exam question. Oral and IV route. What are the differences or advantages or disadvantages? So this is just a summary of today's class discussion. And this is the MCQ. Which of the following route the drug is most likely to be subjected to first pass metabolism? Now comment whatever answer is right. So this was the today's class about the routes of drug administration. Like, share and subscribe my channel to watch YouTube video on pharmacology, and let me know in the comment section that which topic you want to cover next.